8 signs of liver problems shown on your skin, and 7 tips to avoid these issues. In today's video, we will explore the signs your body might be sending you about the health of your liver. Have you noticed some red and brown spots on your legs? This could be a warning of more serious issues. Do you know the effects of spider veins and how they might be connected to your liver? We will discuss this soon. Did you also know that your cracked heels might indicate something more than skin problems? Stay with us to find out the connection between the health of your liver and the appearance of your skin. Lastly, you will be surprised to learn how a simple itch on your feet can be a sign of serious liver conditions. Don't miss this crucial information and discover how to keep your liver healthy. Let's get started. Sign 1. Red and brown spots. The red and brown spots that appear on the lower legs might be a sign of poor blood circulation, often associated with underlying health conditions, such as liver problems and diabetes. In the context of the liver, this poor circulation can result from liver failure, where the damaged organ struggles to purify the blood of toxins and harmful substances. This inadequate process can lead to the accumulation of substances, which, in turn, cause inflammation and discoloration of the skin. It's important to note that these spots can also be a sign of venous stasis, which is the pooling of blood in the veins, usually due to chronic venous insufficiency. Each case is unique, and it is vital that a doctor evaluates these symptoms to determine their exact origin and recommend appropriate treatment. Sign 2. Spider veins. Spider veins are small superficial dilations of the blood vessels, usually found on the legs and displaying a pattern similar to a spider web. This sign might be linked to liver cirrhosis, a serious condition that results from the scarring of the liver over time due to continuous damage. Cirrhosis can lead to hormonal changes that affect the health of blood vessels, making them more fragile and prone to ruptures. Furthermore, the reduction in liver function impairs the liver's ability to process hormones, which can result in a hormonal imbalance that promotes the appearance of these veins. This can also be an indication of portal hypertension, which is an increase in pressure in the portal vein, a large vein that carries blood to the liver. Given these signs, it is crucial to seek medical evaluation to investigate the underlying cause and, if necessary, start a treatment that can range from medications to more complex interventions depending on the degree of liver disease progression. Sign 3. Cracked heels. Cracked heels can be more than just an aesthetic issue, indicating at times nutritional problems that may be related to liver function. A healthy liver is essential for the metabolism of nutrients, including vitamin B3 and omega-3 fatty acids, essential for maintaining skin health. Vitamin B3, or niacin, helps keep the skin hydrated and inflammation-free, while omega-3 fatty acids have anti-inflammatory properties that also contribute to skin health. When the liver fails to process or distribute these nutrients efficiently, due to diseases like hepatitis or cirrhosis, the quality of the skin can be compromised, resulting in dryness and cracks in the heels. Furthermore, the liver's inability to properly regulate toxins can lead to the accumulation of harmful substances that also affect the skin. Therefore, in addition to using moisturizing creams and exfoliants for localized treatment, it is important to consult a doctor to assess liver function and ensure that there is no underlying condition affecting overall health and nutrition. Sign 4. Itchy feet. Itchy feet can be an uncomfortable and disturbing symptom, indicating possible health issues, including those related to the liver. Specifically, this symptom can be a sign of fluid buildup due to a condition known as hepatic congestion, where the liver is overwhelmed and unable to properly filter toxins from the blood. This problem leads to the accumulation of substances like histamine, which is an immune response that causes irritation and inflammation in the skin. Liver congestion can also result in jaundice, another sign of poor liver function, which can manifest through generalized itching. Moreover, the liver plays a crucial role in regulating fluids in the body. When its function is compromised, it can lead to an imbalance that results in edema, exacerbating the feeling of itchiness. Given such symptoms, it is essential to consult a specialist to conduct appropriate tests and determine the root cause of the itchiness, as effective treatment often requires addressing underlying liver conditions. Sign 5. Hot feet and bad smell. Hot feet and a bad smell can be more than a simple issue of personal hygiene. These symptoms may indicate a more complex problem associated with liver overload. When the liver is under stress and unable to process toxins properly, this can lead to systemic overload, manifesting through seemingly unrelated symptoms, such as changes in the temperature and odor of the feet. The detoxifying function of the liver is crucial for eliminating harmful substances from the body, and when compromised, substances like ammonia can accumulate, changing the body odor. Furthermore, inadequate liver function can affect the body's thermal regulation, resulting in abnormally hot feet. These symptoms can also be exacerbated by fluid retention, a common condition in advanced liver problems such as cirrhosis, which worsens blood flow and thermoregulation. Therefore, if these symptoms are persistent, it is vital to consult a doctor to investigate liver health, as well as consider dietary and lifestyle adjustments to support liver function. Sign 6. Pitted edema. Pitted edema in the legs, characterized by the formation of a temporary depression when the skin is pressed, is a classic sign of fluid retention that may be associated with liver health issues. This condition often occurs in scenarios where the liver is compromised, such as in hepatic cirrhosis, where the scarring of liver tissue prevents the organ from functioning properly. When the liver fails to process and eliminate fluids as it should, blood pressure in the veins that carry blood to the liver, portal vein, may increase, leading to the accumulation of fluids in tissues, especially in the lower extremities. Furthermore, inadequate liver function can result in hormonal imbalances that affect sodium and water retention in the body. Pitted edema is not only an indication of liver issues, but can also be a sign of heart failure, kidney failure, or nutritional deficiencies, reinforcing the importance of a detailed medical evaluation to determine the exact cause and implement appropriate treatment to alleviate symptoms and treat the underlying condition. Sign 7. Fungal infections. Fungal infections on the nails or skin can be an indication of deeper imbalances in health, especially related to the liver. Compromised liver function can negatively impact the immune system and alter the balance of intestinal flora, conditions that favor the excessive growth of fungi. The liver is essential for regulating various biochemical processes, including maintaining the balance of the intestinal microbiota. When there is liver dysfunction, such as in cirrhosis or hepatitis, the liver's ability to filter toxins and regulate hormones is diminished, which can result in an environment conducive to fungal infections. Additionally, liver impairment can lead to changes in blood sugar levels, also creating favorable conditions for the growth of fungi. These symptoms are an important warning that something more serious may be happening with the individual's health, making it crucial to seek medical consultation for evaluation and appropriate treatment, not only for the fungal infections themselves, but also for the possible underlying liver issue. Sign 8. Changes in nail beds. Changes in the nail beds, such as the loss of pink coloring and the disappearance of the characteristic half moon at the base of the nails, can be revealing symptoms of circulatory problems, often related to liver issues. The function of the liver is crucial for purifying the blood and maintaining a healthy circulatory system. When the liver is compromised by diseases such as cirrhosis or hepatitis, its ability to process nutrients and eliminate toxins is affected, which can lead to inadequate oxygenation of the blood and consequently changes in the appearance of the nails. These changes are reflective of possible anemia or hypoxemia that may arise due to poor blood circulation and the overall health state of the liver. Furthermore, the health of the nails can be impacted by nutritional deficiencies resulting from inadequate absorption of vitamins and minerals, also related to poor liver function. Therefore, changes in the nail beds should not be ignored, as they can be indicative of serious medical conditions that require immediate professional evaluation and intervention. 7 tips to help you avoid liver issues. 1. Maintain a balanced diet. Consume foods high in fiber, such as fruits, vegetables, whole grains, and legumes. Reduce your intake of saturated fats, refined sugars, and simple carbohydrates. Include lean proteins and opt for healthy fats, such as those found in fish, nuts, and olive oil. 2. Avoid alcohol. Excessive alcohol consumption can cause severe damage to the liver, including cirrhosis and inflammation. If you choose to drink, do so in moderation. According to general guidelines, this means up to 1 drink per day for women and up to 2 for men. 3. Exercise. Regularly. Maintaining a healthy weight helps prevent non-alcoholic fatty liver disease, one of the most common forms of liver disease. Regular exercise also improves overall metabolic function, which benefits liver health. 4. Do not smoke. Smoking not only harms the lungs, but also increases the risk of liver diseases. Quitting smoking is an important step to protect your liver. 5. Use medications cautiously. Avoid unnecessary use of medications and follow directions when taking prescribed or over-the-counter medications. Some medications can have harmful effects on the liver if taken improperly or in excess. 6. Avoid toxins. Limit direct contact with environmental toxins and chemicals, such as insecticides, pesticides, and industrial chemicals, which can help reduce the load on the liver. 7. Regular health checkups. Performing regular health exams that include liver function tests can help detect any liver issues early, allowing for timely interventions. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.